My name is Michelle Petri. I'm a professor at Johns Hopkins in Baltimore. My role is as the director of the Lupus Center. I've been doing this a very long time, 37 years and counting. And before that, I was a rheumatologist at the University of California at San Francisco. So I'm what's called a lupusologist. One of the treatments we're still stuck with in lupus, prednisone, can also cause brain complaints, including anxiety, depression, brain fog, insomnia. The reason we still use prednisone for lupus is that it broadly suppresses the immune system. It does so quite quickly, and because it's generic, it's cheap. But why should prednisone affect the brain? That's what we call an off-target effect. Prednisone binds to lymphocytes, the white cells that drive lupus inflammation, but prednisone binds to multiple steroid receptors on other cells where we don't want it. Obviously, we don't want it binding to brain cells. We don't want it binding to bone cells either. But our problem is that steroid receptors are virtually everywhere in our bodies. Some of the prednisone side effects on the brain can be manageable. For example, insomnia, we might be able to help with over-the-counter medications, but some can be quite serious. And I am particularly concerned about depression. Depression occurs in a whopping 1/3 of my patients. And when we studied predictors of depression, we found that some kinds of active lupus played a role, including the very bad skin rash called discoid, and spinal cord involvement called myelitis. But prednisone was there too. And quite interestingly, what we call a dose response, people exposed to 20 milligrams or higher doses of prednisone. So obviously there are two things that need to happen. One is physicians need to add other medicines to control lupus if the prednisone dose has to be very high. And in fact, the 2023 guidelines on how to manage lupus make it very clear that our goal for maintenance prednisone should be 5 milligrams or less. It's important to remember that depression will present in different ways in different people. It can present as depressed mood, but also it can present as fatigue, insomnia, loss of weight, other ways. So verbalization, communication is always going to be key in the patient-physician relationship.